Hello and welcome. I'm Dawn Argula, CEO of the Livermore Valley Chamber of Commerce. Thank you for tuning in today for an update with Dr. Nicholas Moss, Health Officer for Alameda County. We apologize for the slight delay, a little bit of technical issues that we're dealing with here. Nothing new as we operate in the virtual world during the pandemic. Joining me today are my chamber partners, the CEOs from the Dublin Chamber of Commerce, Inga Houston, and the Pleasanton Chamber of Commerce, Steve Van Dorn. And I also want to extend a big thank you to Amos Productions for producing today's event. This is being streamed on YouTube Live, and a recording of this will be posted on our individual chamber websites after the event today. To all of our viewers, after an update from Dr. Moss, we will take questions. Please post your questions in the chat, and those will be read to Dr. Moss during the program. But before we introduce Dr. Moss, I invite Inga and Steve for a few opening comments. Inga?
There we go. Thank you. Good afternoon. This is Inga Houston with the Dublin Chamber of Commerce. Thank you, everybody, for joining in and joining us with Dr. Moss. And how lucky can this be the day after things opened up in our county? And thank you, Steve and Dawn, for helping make this a nice collaboration. And Jody, thank you for producing this for us with Amos. Take care.
Good afternoon, everyone. Steve Van Dorn, President, Chamber of Commerce. Thank you, Don, for bringing us all together again. Thank you, Dr. Moss, for your valuable time. And Jody, always appreciate your help behind the scenes. So looking forward to a great discussion today, and talk to everybody soon.
Thank you. And now we want to introduce Dr. Nicholas Moss. Dr. Moss is the health officer for Alameda County Public Health Department, and he was appointed to that position officially in November of last year. Prior to that, Dr. Moss was serving in an interim capacity during the summer. On behalf of our Chamber of Commerce, I just want to express my thanks to Dr. Moss and his team for being accessible to our businesses and our business sectors here in the Livermore Valley throughout this pandemic, because the communication is critical in order to help us all get through this really challenging period of time. And with that, I welcome you, Dr. Moss.
Thanks, Dawn, Inga, and Steve. I'm really glad to be back at this forum, and I think, certainly we're still amidst a pandemic, very serious situation, but lots to talk about, and maybe a slightly more upbeat conversation today than our last one. I certainly hope so. So with that, I think we're starting with some slides. So just some brief slides on the data status, that kind of stuff. I think the discussion will be as useful as these slides, but I'll get through them pretty quick. And I do have a few slides on vaccine. I'm sure there'll be a lot of interest in that. So just some key points about the status of the pandemic locally. As I would guess most people in this group are aware, the regional stay-at-home order was lifted yesterday. All my dates are off on the slide set. Yesterday, January 25th. So that put us back in the purple tier. We are back in the tier system that we were in before, and the situation is still bad enough here that we have to be in the purple tier for the time being. But things are improving. They're improving every day. Schools are actually not covered by this order, but they are impacted by the improvements in case rates, and it'll start with K through 6 schools being able to open fairly soon under revised state guidance with approved safety plans. And then I've been mentioning the variants in all my presentations recently. You probably heard a lot about them in the news. Variants, the impact on us locally remains to be determined, but I think it's important for people to realize that not only are we still in a period of high transmission locally, but future surges and curveballs are possible with this virus. Next slide, please. Okay, so this is our daily reported cases by date. And we peaked the highest number of cases reported was about 1,300 on January, I believe it was January 7th. And those are those blue lines. The yellow line is an average. It kind of smooths out the curve a bit. And you can use that to see the trends. So we really took off shortly after Thanksgiving. We actually had a softening in the middle of December. Things began improving, and we were still having a lot of testing being done the week before the Christmas holiday. And I think that is because of the early adoption of state
Hello again, everyone. Hang in there. We keep losing internet connections here, and we're not sure what's going on, but our producers are remedying that right now. Hopefully, we'll remain on for the duration. So we will continue on with the program. Dr. Moss, if you'd like to take up where you left off.
Sure. Yeah, I mean, we're all Californians. A little bit of rain and everything goes haywire, right? Okay, so I think I don't know how much you heard, but I think the upshot of this slide is we're doing better. The holidays definitely contributed, but it could have been worse, and we're on the downslope now. Still high rates of cases reported. Next slide, please. So I think we can skip this one. It's pretty much the same information we were covering. This is our daily case rates. It's the same data, daily reported cases, but it's expressed as a rate, number of cases reported per day per 100,000 county residents. And the reason I want to show this is you can see the tier thresholds. Now, the state uses these thresholds to help us advance through the tiers. But I want to urge some caution here because the state actually uses an adjusted rate. So they'll adjust our case rate, which is in the mid 40s right now. They'll adjust that downward according to the amount of testing that we're doing. So we're actually under 30 with our adjusted rate, but we still have a ways to go before we hit that red tier threshold of 7 cases per 100,000 per day. So that we're in purple tier. We'll be there until we cross the red tier threshold, both for our case rate. And if you bring up the next slide, for our test positivity. Test positivity, we're doing better. We do a lot of testing in Alameda County, and so we're already in blue, meeting the county wide red tier threshold for test positivity. The yellow line is test positivity in our most socioeconomically disadvantaged census tracts, and the state uses that to make sure that we're not leaving anybody behind as we move through the phases of reopening. Some of you may remember this from the fall. So that is also decreasing, not quite to red tier levels yet, but I think we really need that adjusted case rate to fall to get us to red tier, which will allow even more reopening than we were able to do yesterday. Next slide, please. Okay, so a lot of this surge was about hospitalizations and intensive care unit hospitalizations. These are the number of people hospitalized per day with COVID in Alameda County in blue, and then the number of people in intensive care unit beds in yellow. And this is reported by the hospitals right here in the county. And you can see those lines have been pretty flat for a couple weeks. What that's meant is that as our I think you saw that we had that two peaks. We had a sort of mid-December peak and then some improvement, and then a late December, early January peak. And so because of that, we were starting to improve, and we're getting people out of the hospital, but then we were adding people to the hospital because of the late December peak. And so the upshot was that we really stayed at a very high level of hospitalizations. We avoided the kinds of situations they saw in Los Angeles. And I think that was at least in part due to, the early adoption of stay-at-home orders and then the state's order coming in the middle of December, and really everybody's sacrifices locally and across the Bay Area. I think it could have been worse. It was not great, but it could have been worse. These numbers have just in the last few days started to fall a little bit. They tend to lag behind changes in case rates by about 3 weeks. So now is about when we would start to see them drop if we peaked in our cases back on January 7th. Next slide. I think we can skip this one. It's really similar information to what I just shared. And as we covered, the stay-at-home order was lifted. We are back in the purple tier as of yesterday. The notable open sectors: outdoor dining, outdoor zoos, personal services, hair and nail salons can operate indoors. All of these are subject to state restrictions. They haven't changed that much since early December. But I encourage everyone, make sure you've looked at the state guidance and restrictions for your industry. As I mentioned, red tier, when that adjusted case rate falls a little bit more. Schools, I covered a little bit at the top. So the state revised their schools guidance over the last several weeks. And although schools were not specifically limited by the regional stay-at-home order, we were not able to let any schools open while our adjusted case rate is over 25 per 100,000. That, as I said, is at 28 right now. Once it gets below 25 for 5 days, then K through 6 schools will be permitted to open if they have an approved safety plan. Some of you probably know that schools that were already open before the winter surge were allowed to stay open. The idea being they had got their systems in place, they knew what they were doing, and they could continue doing what they were doing. But schools that hadn't figured it all out yet, hadn't tried anything with actual students coming back to classrooms, were not going to be able to do that in the middle of the surge. Other schools will be able to open about 5 days after we enter the red tier. Again, this is all state restrictions. I think many of you who are involved in this universe know just because it's permitted doesn't necessarily mean it's easy to get everything set up to get schools back open. But nevertheless, this is where the state guidelines are, and we're going to follow the state. And in fact, that's true really for our sector, these sector by sector restrictions across the board. In the fall, we were moving slowly. I think we were still questioning some of the state's decisions. We really felt like it was important to move slowly. I feel more confident that the system the state has in place is good. I also think that we might be able to squeeze a little bit more public health prevention out of being more restrictive in Alameda County, but it causes a lot of confusion when we do things differently from what the state is putting out. And I think that the relative benefit that we're getting from additional restrictions has decreased over time. And so we really are going to try to move with the state as much as possible. That said, if we need to do something to protect public health in Alameda County, we will do it. We do still have a local health order. We kind of need that for some administrative reasons. It generally points to the state guidance, and then it has our more general risk reduction guidance here, which is stuff everyone knows. Face coverings, keeping distance from each other. Gatherings are permitted by the state, but they're very limited. No more than 3 households, should be outdoor only in the purple tier. And so really we want to make sure that people apply those kinds of broad strategies to any setting, indoor, outdoor, their work setting. We really want to make sure that people are following those simple rules that we know work. Next slide. I mentioned the variants at the beginning. Not much to add here other than we have only a very limited picture of the variants that are circulating in the United States because we don't look for that variant information. We don't sequence the viral specimens of most of the specimens that are identified. So we do regular COVID testing, which can tell whether somebody has an infection or not. But we don't actually do that additional testing that tells you what the variant is. We do a little bit. I think it's about somewhere between 1% and 5%, depending on where you are in California. Nationally, it's about 1%. This is increasing because over time, it's become apparent that the viruses, these variants are popping up more frequently than we thought they would, and that could impact things. So I expect that we'll have more information about circulating variants in the U.S. over the coming weeks. And we do have a little bit. I will tell you that the UK variant is here. What that means for us all remains to be determined, although there's certainly concern that it could spread a little more easily, and therefore it could displace some of the other COVID that's circulating. Would that cause additional surges in the short term? I really couldn't say, and I don't think we should jump to any conclusions. What's going on in the UK may be different from what's happening in the US in February. We're almost in February now, so I'm very cautious about predicting what this means for us. But it is certainly concerning, and there was a report that the UK strain could have potentially a slight increase in mortality. I want people to understand, overall risk of death is very low, although it's higher for older adults when someone gets COVID. And so we're talking about a small increase in the percentage. And that is observation that's been made. It's based on very limited data from the UK. And so I really urge people to take all of this with a grain of salt, cause for concern, but not cause for new policies at this time. And that really goes for all of these strains. We need to learn more. There's nothing to suggest that the prevention methods that we have available that we know work will be any less effective. Face coverings, distancing, hand washing. Vaccines, for those who follow this issue closely, there's some concern that a strain that's been noted in South Africa and another one in Brazil might have decreased sensitivity to certain antibodies against COVID that we generate and the vaccine helps us generate. But we don't have anything to suggest that the vaccines will not be effective. In fact, most experts think they will continue to be effective against all of these strains. The question is, could something else emerge over time? And when I say over time, I'm talking about probably years, not months. But it's something that the experts are watching closely. So the upshot of all this is variants it's a real issue. We need to watch it carefully. We need to watch the science carefully. Doesn't change anything for the short term for us. All of our response policies are going to stay the same. And as we learn more, we'll share more. So sorry, it's a bit of a wonky issue, but I think one that people are rightfully concerned about. So I wanted to comment on it. Okay, switching gears to vaccines, I think is the next slide. And news changes all the time with COVID. A big press release by the governor today that is going to impact things. We thought something might be coming, but some of these slides are now a little bit out of date, so I'll do my best. We are still vaccinating our huge population of healthcare workers in Alameda County. About 10% of the county population is healthcare workers. Some of those are healthcare workers actually who live in other counties, but they work here, and it has always been the plan for employers to take the lead in vaccinating their staff. So some of these people are not county residents, but they serve our county health needs. So we are, I think we're about 2/3 of the way through this group, maybe a little further now. But we have more healthcare workers than a lot of counties. So when you hear about other counties doing other groups, the reason is that we have a lot here. Older adults are, for the most part, 75 plus, are able to access vaccine through certain large healthcare providers, mainly your Kaisers and Sutters of the world, who get vaccine from the state directly. And once they finish with their healthcare workers, they can use the vaccine that they have to start vaccinating their older adult population. And I think that's fine. Another thing that's not captured here is that residents of nursing homes and memory care facilities, places like that, are being vaccinated through a federal program. So that's also not, those patients are not reflected here. The big issue with vaccine, and I'm sure you've heard this in the press, is how much we have. We get vaccine every week, about 15,000 doses, but there's 1.7 million residents of Alameda County. The pace is going to be slow for the time being until that supply picks up. And this is not unique to Alameda County or California. Let's move on. Let me see what else I have in these slides. So subject to changes, right. The current framework is really, it's going to continue to prioritize older adults, now 65 and up, and education workers, emergency service workers, and food and agriculture workers due to the levels of risk and also the roles within economy and society that those sectors play. We're talking about a lot of people, millions of people across the state. So it's going to take a while to get through these groups. But importantly, older adults are in there, and that's good because that's where we see the greatest risk of severe disease. After that, I think we're really looking at the state, and the state is really focusing more on an age-based approach. I'm sure that there could be additional tweaks, but that's where we are today. Next slide, please. I'm going to skip the slide because this also may change how vaccine gets distributed. And I think we can get to a more pertinent question of how will people get vaccine on a later slide. Oh, I don't have it. Okay, I will say that the distribution is going to continue to happen both through vaccination sort of events, smaller events, larger events, but also a lot of it's going to be go through the healthcare system, and the state is shifting gears a bit to try to centralize this, streamline it, make it so that vaccine is being directed as well as possible so it can get into arms as fast as possible. And so, there's some question marks about what that exactly means on the ground, but it'll continue to probably be vaccine events and healthcare providers together as sources of vaccine. And I'm sure there'll be lots of questions about all of that.
Okay. Thank you, Dr. Moss. Thank you, Dr. Moss. So we do have some questions that are coming in and some that have been emailed to us, but a question on the vaccination deployment. So we know that we are mobilizing at the Coliseum site in Alameda County. Is that something that is coordinated through the state deployment of the vaccines, or is it something that the county is? I mean, it's kind of like who's on first. It's a little confusing.
So as of right now, we are still working with many partners on mass vaccination sites at the Coliseum and also at the fairgrounds. Those are the first two sites up to bat to be these kind of large scale sites, and we were aiming for February. In order for those to be effective, you need a lot of vaccine. Like the amount of vaccine we have in a week, you want in a day. So the key is to time those so that we have the vaccine supply to support the numbers of people that we expect to get scheduled and have appointments at those spots. All of this is subject to revision as we learn the details of the state's announcement today. I certainly hope that we're going to be able to continue with these as planned. It may be that the state has a greater role in the way these roll out, but for the time being, I think we need to keep working as if they're going to open. They're going to open in February, probably not February 1, but soon enough, and that they will be serving people who are eligible to get vaccinated.
Okay, thank you. All right, so the way we usually work this is we do the round robin with the CEOs with the questions that come in. So, Inga.
Ooh, I get to be first. Can you hear me? Okay, the first question is, Dr. Moss, you have indicated previously that Alameda County will fall in line with the state tier system for business reopening. Is this the case, or will Alameda continue to be more restrictive?
No, we're following the state tiers. I think that's the right thing to do, both for public health and for making it sort of feasible and understandable for all the businesses and residents.
Okay, Dr. Moss, this is not a question in the chat, just a personal question I have is, we're hearing that there's a lot of vaccines in the state, but they're not getting to the counties. on the media. Is that really the case, and if so, what is causing the slowdown in the deployment to the counties?
Yeah, so I would say this is complicated, but this is the truth on the ground is that actually there's a lot of vaccine going out. There's a lot of vaccine in California. A lot of vaccine has been delivered in California, much more than you would think from the media reports. California is a huge state, but a lot of doses have been delivered here. I don't have an updated number. It's probably around 2 or 3 million at this point. It's a lot. But we're a big state, and so even given that, the supply at the county level is pretty low. We get around 15,000 doses a week right now. We're hoping that supply will start to increase soon, but it's not going to double or triple overnight anytime soon. It might go up, 15, 20% in the coming weeks, we hope. So it's coming in relatively slowly given the size of the county, just because there's only so much vaccine around and there's global demand. In fact, demand is a good thing. We want people to want to get this. So that's one issue. Another issue is everybody needs to get 2 shots. So a lot of the extra vaccine that you hear about is the scheduled second shot for people who already got or about to get their first shot. So some people ask when they see our numbers, which are posted on our website, how come you have 20,000 doses of vaccine sitting around? Well, 18,000 of those are actually, I think it's 15,000 today. 15,000 of those are doses that are earmarked for people who already got their first dose and they need their second, because these vaccines, these early vaccines that have been approved, require 2 shots. So that vaccine is spoken for. And we've tried to have some flexibility around using some of those second doses. But the fact is, as long as the supply coming into the county is not increasing, and as long as we still believe that you need to give everybody 2 shots, and we do believe that, although I know that some other countries have explored a one, just giving 1 shot. As long as we're sticking with the FDA approved regimen and the CDC recommended regimen, we cannot use those second shots for too many other people. We need to keep them for the people who need their first shot. So it looks like we have shots that are sitting on the shelf, but actually those are part of the vaccine regimen that's been prescribed to one person, and that person is halfway through.
Thank you.
Dr. Moss, on the vaccines, is the second shot the same as the first shot? Or
Yeah,
is it different?
It is the same. So each there's 2 vaccines, and once you get the first shot of one, you should get the second shot of the same vaccine. But otherwise, they're exactly the same. There's nothing different about them except that the reason we call them second shots is that they were allocated to us as second shots. They went together so that we could control the inventory and make sure that we had enough vaccine to give people their second shot in a timely manner. Now, CDC has said a couple things. It said, and I think they've done this with the FDA's blessing, but they said you can mix and match. We're not doing that. We're trying to give people the same thing they got the first time around, because that's what's been tested in clinical trials, and that's what's been shown to work. Although my understanding of the vaccine is that mixing and matching probably would be fine, but if we don't have to do it, let's not do it. And then the other thing that we can do is we can delay it up to 6 weeks, according to CDC. Because those clinical trials showed that people who got the vaccine, their second dose a little bit later, they still really got a high efficacy. The vaccine still worked really well. So we have a little bit of wiggle room. We can delay things a little bit. But generally speaking, we want to give people that second shot in a timely manner. Otherwise, they are really exactly the same. It's the same thing.
Okay, super.
Okay.
Thank you. And so we do have a lot of questions. And so everyone who's on here, just know that we are on here. Dr. Moss has given us until 3:30. So we will get to all of your questions.
And I'll speak fast.
Yeah.
Okay, our next question
laughing because
is.
she already knows that I talk too much.
Can you hear me? Okay. My next question is, we have a listener who is turning 65 in a few weeks. How do they find the best way to get the vaccine, get into the 65-year-old queue for their age group? Do they do it through the county?
Yeah, there's a few options. So first of all, I think it's worth calling your healthcare provider. Some healthcare providers are going to be starting to schedule older adults. They have to do under the state's restrictions, they have to start with the 75 and up first. But so depending on their supply, they may be able to start getting those 65 and older, and they may start scheduling those appointments. And so I think it's worth calling your healthcare provider or looking up on their website and just seeing what information they're sharing. It varies from provider to provider. If you don't have a healthcare provider or they're not scheduling right now, the other thing you can do is go to the Alameda County Public Health Department COVID vaccine website. And let me see if I can read that. I'm going to give the web address here. Okay, so COVID-19, the number 19, covid-19.acgov.org/vaccines. And maybe we can put that in the chat box. Go to that website. You can sign up if you're an Alameda County resident and to be notified when you'll be eligible to receive a shot. And that's the way in which, for people who are going to need to get vaccinated through one of these mass vaccine sites, to get information about how they can get an appointment when we start hitting that 65 plus. And then there's yet another option, because the ground is changing under our feet, and I want people to be aware of this. I don't have the web address handy, but the state is going to allow, I think they just announced today, a system where people can sign up to get information about when they can receive vaccine, and the state is going to manage that. This is kind of a new program being launched, I think, right now. So just be aware that they may still be working the glitches out, but the state is going to provide a way for people to sign up to learn more. So those are the three things I suggest. COVID-19.
Thank you.
.acgov.org/vaccine. All right.
That's right.
Cool. Dr. Moss, next question comes from Carolyn, and she's with the local school here, and her school nurses would love to be able to vaccinate their staff. How can we get vaccines for our teachers? Can we order through you and the county?
Yeah, so right now, up until the last few days, healthcare providers who met certain conditions could sign up to be vaccinators. You had to be able to store the vaccine in a proper refrigerator or freezer. You had to register for the state's system to track vaccine administration. So there's a few hoops to jump through, but providers could do that. And if they met those state restrictions, then we could allocate vaccine to them to use, but only to give to people who are eligible. So in Alameda County, that still meant healthcare workers. I think because the state is shifting gears a little bit, it's not clear to me that providers will be able to continue to sign up for the time being. We're waiting to learn more, but hopefully we'll learn more in the coming days from the state about how smaller medical providers can sign up. Educators are going to, and I think other school staff are going to continue to be a high priority according to the state, and they should be able to access vaccine through other mechanisms. So even though the school clinic might not be able, school nurses might not be able to vaccinate school teachers immediately, I do expect that soon, again, hopefully in February, hopefully early February, our school staff will be able to access vaccine, at least through some mass vaccinating mass vaccine sites in Alameda County. And I'm sorry, I would have been more certain about this a couple days ago, but I just want to, it's not clear how this will be affected by what the state announced today.
All right. So just a heads up, a few of us are having some issues with their internet connectivity. So we will back each other up. And if you kind of break up, then one of us will step in and finish answering your question, asking your question. Okay, there seems to be a significant variance in cases even within different parts of the county. Is that considered?
Yeah, so what that, I think what you're referring to is the number of cases diagnosed or the case rates in different zip codes in the county, which we share on our website. Now, a couple things to note about that. That's based on the resident's address, right? So you could have got your infection anywhere in the county or even outside the county, but that's the address where you live when the case is reported. So if you live in, say, Hayward, and you count as a Hayward case, you still might have got your infection any of a number of places. And so that is an important thing for people to keep in mind here. When we look at that data, the neighborhoods where we have seen the highest rates are the neighborhoods where we have high concentrations of people who have to work outside the home, often in essential industries, manufacturing, food and agriculture, healthcare, where there was a greater risk of exposure to COVID at work. And they are also the neighborhoods where housing is more dense. You have more people living in a smaller space. So COVID spreads really well in that setting. And so for that reason, we've seen the case rates vary across different neighborhoods and different communities in Alameda County. And this is true not just in Alameda County, but all over the world.
Okay, thank you.
Thank you. Okay, we have one from our regional destination marketing with Tracy. With the potential to move to red tier in a matter of weeks, will 25% indoor dining become available to boost economic recovery, perhaps in time for Visit Tri-Valley's first restaurant week in February 19th to the 20th?
Hi, Tracy. So it's a great question. I try not to predict the future too much with COVID. I think it is possible that we would be in red tier by, that's about a month from now, about 4 weeks. It's possible, but I don't know for sure. And I understand people would love to have some certainty there, but I can't guarantee it. Once we hit red tier, we'll go to red tier restrictions, which I think, and I don't have the book open in front of me, but I'm pretty sure you're right that there would be some indoor dining permitted. So that's the best I can do today.
We're hoping. Thank you.
All right. Next question, Dr. Moss, is from Adam in the city of Livermore. We continue to hear of challenges from 65-year-old residents that they cannot access vaccine appointments at the same rate as other California counties and are starting to look to other counties. Any recommendations?
Yeah, well, as I think everybody probably knows, not all counties are created equally. Alameda County is one of the more populous counties in California, and it also has one of the largest healthcare systems. And the way the state distribution system is set up, we got to vaccinate those healthcare workers. And I think that's the right call because, as you saw from the winter surge, the healthcare systems can run into real trouble real quick, in particular with staffing. So that's always been the goal, and that's been pretty consistent. A lot of other things have changed around and shifted with vaccine prioritization. I don't think anybody has moved healthcare workers down, but we do have a lot here, and that means that we are not moving at the same pace as other counties. I think the state is going to try to shift things so that it's a little more uniform, but we're still working with the old system, and that's simply where we are. I do know that for people who have been able to access vaccine through their healthcare system, that it has often meant driving to another county for an appointment. And if that's what your healthcare system offers you, I think that's fine. But until we have more supply in Alameda County, we can't really. There's nothing we can do to accelerate things without more vaccine.
Thank you.
Okay, Dr. Moss, as you may know, the Livermore hosts an annual rodeo every year in the month of June. And that kicks off with a parade. I think it's the first or second weekend in June. It's the second Saturday in June. What tier are parades allowed, and what tier are rodeos allowed?
I don't know the answer off the top of my head. You can email COVID recovery at acgov.org, covidrecovery.org, and ask, or you can look at the state's blueprint for a safer economy website. Now, there's a lot of information on there, and it might take a while to sift through. But a couple things. First of all, outdoors better than indoor, and I think both of those are outdoor activities, and they're activities where people can keep their face coverings on. So I think that's promising that they'll be, and we're talking about months from now, and so maybe the rule book will have changed by then, for better or for worse. But I think those are both reasons to be optimistic if we're not in the middle of some kind of surge at that point, and more people have been vaccinated, that some version of those events could probably happen. But I can't tell you, first of all, what tier we'd have to be in today for them to work, and certainly what things will look like in June, which seems like an eternity to me, although I know it's not that far away. But I am optimistic for outdoor events with the right restrictions in place, that will probably be, some of those will be able to be held.
Okay. The next question is, do you want to go ahead, Dawn?
Well, I was just going to do a follow-up because it's from the same individual. They're just wondering if there's a need for volunteers to help staff the vaccine events.
Not right now. I think it's something that we were anticipating in the future as we had more vaccine and we're scaling up events, that there would be a role for volunteers. And again, this is a little bit contingent on what happens with the state and how much of a role we still have in planning these large events. But I expect that down the road, when there's more vaccine supply, that we will need some volunteers. Just not quite yet, at least not through the public health department. Other entities may have volunteer opportunities.
Okay, great. The next one is from Gina C. She owns an event facility. People put their weddings on hold. What tier will allow for events to occur? We are trying to help them plan as they are quite anxious. With any words of wisdom for the wedding crowd?
Yes, I know. The ceremonies should be allowed in purple, even if I remember correctly. But I think the question is more probably about receptions, and I'm going to go with either orange or yellow, but I don't have the tiers up in front of me. I'll bring them up. I'll see if I can confirm that. But I think it's going to be orange or yellow for that for like a reception to occur.
And between the two, if it's even allowed in orange, yellow, the difference between yellow and orange might be the number of attendees allowed.
That's right. So yeah, capacity, what percent of your space you're using. Outdoors will be safer than indoors, and the big risk is eating indoors or indoor activities where mask comes off. So I'll see if I can pull that up. But
do you want us
we
to
can
move on to the
continue.
next question? Okay.
Great.
You can
Okay.
multitask.
Next question. Very good one. How do essential workers get prioritized in the process of being vaccinated, or is there any path towards that? Essential workers. And
So
I'm sorry, it's not more clarified. That's just which I mean, healthcare workers are essential, so they're getting
right.
vaccinated. So I'm not sure what this question is referring to.
Well, so and things changed really in the last few days. So now it's in addition to healthcare workers, food and agriculture workers, school and childcare workers, and emergency workers. And those are, I think the state has or will have soon more detailed description of what those categories are. But those are the broad categories. And after that, I believe the state is going to move away from occupation-based tiers and focus more on age. But those people who are in those broad categories will be prioritized. Within those groups, I think you have to be careful, after age and those broad groups, you have to be careful adding additional layers of prioritization. It gets very difficult to, create a system that can easily deliver vaccine if there are too many wrinkles in it. I think that's been a challenge from the start in California, to be honest, and that's why the state is pivoting a little bit.
Okay, and how do people younger than 65 with an underlying health issue get a vaccine? There is nowhere on the forms to offer that option.
Okay, I apologize. I thought when you completed the county resident form that you could indicate health conditions, but so it's very likely, because we don't have visibility into people's medical history and not everybody feels comfortable sharing, that's going to be something that happens more at healthcare provider vaccine delivery programs where they actually have your health history. That's not going to work for everybody, and we realize that. But I think that's why you're not seeing it on our forms. If you're not, the other thing is that we haven't. It's 65 and up, and I think within that there is some prioritization for people 65 and up with certain health conditions that are, I believe, defined by CDC. But for younger groups, because we haven't reached those, and we aren't likely to reach them for some weeks. There won't be, even if you're able to sign up to be notified, there won't be much additional information for the time being. So I would focus on age for the time being, and then once we get to those populations, there'll probably be opportunities if you're getting vaccinated through a healthcare provider to be a higher priority based on health condition. But again, the more wrinkles that get added, the harder it is to just move people through the system and get vaccine in arms. And so I think it's a little bit of a balance of getting people at the greatest risk vaccinated and just getting people through the system.
Okay, so the next one is a bit related, similar, it's different, but somewhat related. And developmentally disabled adults, where are they in the vaccine phase tier system?
I think it really goes to age, and then if they're if they're above 65, then the health conditions that put them at high risk for COVID. I don't think there's a separate prioritization for that group. I will tell you that we as a county have invested resources in teams to provide to go out and vaccinate at congregate living facilities, including some facilities where people with developmental delay live together. And so there is an effort to make sure we're vaccinating in those settings, because COVID can spread in those congregate settings.
Okay, thank you.
Okay, the next question. Oh, hold on, it moved. Do hospitals like Stanford, Valley Care, and Kaiser get their vaccines from the county or directly from the manufacturer?
So hospitals, large systems that span multiple counties like Kaiser and Sutter, they get vaccine directly from the state. And I believe it actually comes to them from the manufacturer directly, but the state directs it. And then for other health systems, Stanford Valley Care, for example, they also should, in most cases, if they have the storage facility, I believe that they get sent the vaccine directly from the manufacturer, but we direct the allocation at the local level. So it's for some local providers. And then for very small providers, we actually can store it and then distribute it out to them. But adds a layer of complexity. So we try to avoid that if a provider has the ability to receive and store the vaccine directly from the manufacturer. I'm pretty sure everything I just said is that.
Great.
Thank you.
Next question. Many large employers have the ability to vaccinate their workforces. Any thoughts as to when they might fit into the distribution plan?
Probably further down the road, but I think the state is going to be in a position to try to flex its system. And if there's when we get through these high priority groups and we start talking about larger numbers of people, it's possible that the state does work with some larger employers, but this is pure speculation. I don't know that will happen or not.
Okay. Lots of questions about the vaccine, Dr. Moss. What if you have a reaction to the first shot? Do you recommend returning for the second shot? What if you do not return for the second shot? What protection, if any, is there?
Yeah, so there is some protection from just one shot, but it might not last as long because you don't get that second shot to boost your immune response. And I think it depends how you calculate it, but I think it's around 80%. So it's pretty good. And again, it's a little bit different depending on which vaccine you get, but it's pretty good. But the concern is that it will not last that long. However, people who have certain types of reactions to the first shot should not get the second shot. And it's up to you to work with the vaccine, whoever gives you the vaccine, to make sure. Because some things are expected. You're going to feel crummy potentially for a day. You're going to have a sore arm. There might even be some redness to your arm. Those kinds of things are usually okay. But other types of reactions, more concerning allergic reactions, would be a reason not to do the second shot. So without going into too much detail, I think it's something that you need to, if you have a reaction, you need to check with the vaccine provider and say, hey, this happened. Should I get my second shot?
Okay, and then a related...
Let me just add, so some people will feel crummy for a day, maybe even 2 days after one or both of their shots, and people should prepare for that.
Okay. My 86-year-old mother just had her shot last week, Wednesday, and she said she had a sore arm for 1 day, and that was it. So she's a happy camper. On the vaccine, how long, if you do both, if you're doing the double one, how long can we expect the vaccine to protect us?
Well, it's a great question. So there's these vaccines haven't been with us for that long. So we don't actually know for sure how long the protection will last. It appears, based on what we can see and what we know from vaccines in general, that it should last longer than maybe the protection you would get from a natural infection with COVID. So we know there's a good chance that over time, there's probably some decrease in immunity if you just get COVID. We don't exactly know how long that is. It seems like it's a matter of probably years, not months. But the vaccine creates a pretty potent response, and it should last and offer protection longer. How long that is, and whether there'll be a need for additional boosters in the future, we really don't know because we just haven't had enough time.
Thank you.
Okay, this one, youth sports can happen depending on the tier. Question is, once a sport is cleared based on the tier they fall in, can they practice, play games without restrictions?
Once a sport is allowed for the current tier, it's not without restrictions. There are restrictions. I encourage everyone to read the California Youth Sports Guidance if you're interested in this topic. I will post that in the chat box momentarily. It has a lot of detail. So there are restrictions even for sports that are permitted in a certain tier, and I think it's important to stick with those. We know that transmission has been associated with certain sporting events, and so they're evidence-informed restrictions.
Okay, great. Thank you.
Next question. We've heard this one before, Dr. Moss. Back to our winery friends. There are fewer touch points with serving wine. Why can't wineries be moved into the red tier, which I believe they are not, according to this person. So I don't know if that's the case or not. But anyway, they're asking why they can't be handled the same as restaurants.
The question is why wineries can't be indoors in red tier, whereas restaurants are allowed up to 25%. That's the
correct. Yes, sorry.
Yeah. I wasn't part of the decision-making process that made that determination. I think the concern is bars are actually closed, and I think the concern is that it's still an indoor environment where people have their masks off, and it might be that it's more difficult to regulate. Now, listen, I know there's people who work at wineries who will say, we can regulate that space, and I'm not saying you're wrong. But I'm just speculating why it was felt that wineries maybe couldn't regulate the indoor mixing of people without masks in the way that restaurants can, where people are at a specific table. But I can't offer any more insight than that.
Thank you.
Another question, it's from the same individual, and I think what they're trying to get at is prioritizing staff who are essential workers within an organization. So the sector is designated, but how can they get priority? I mean, who determines that? Within the organization?
So for private organizations, we don't have, we can offer guidance, but for vaccine prioritization, it's really more about the individual. Actually, let me back up. The way we have done this for organizations, for example, for healthcare workers, is to stratify it based on the risk of the role. So if you work in an office, you never come face to face with I'm a doctor. I am a tier 1A priority person, but I work from home. I don't see patients right now. So I'm not as high a priority
Hello again, everyone. Thank you for your patience. This is almost more than my heart can handle, but hang in there. Dr. Moss, let's continue on. Let's see.
Well, I'll jump right in. There's a question in the chat box that I can answer. When I last checked, which was about a week ago now, there was a tiny bit of data from one. Okay, let me read the question for people, which is, do these vaccines prevent transmission in addition to disease? So the clinical trials for the approved vaccines were designed to show that the vaccines prevent disease, and they prevent severe disease, and they're very effective at that. The way the original trials were designed, they were not designed to answer the question of whether they prevent transmission or not. There's a little bit of evidence from one of the trials that does suggest that vaccine, the Moderna vaccine, prevents transmission, and we actually expect it to be true for both of them, but we just don't quite have the evidence yet. I think we'll get it soon. That's why, for the time being, the rules for even for people who are vaccinated are still in place. Wear masks, stay, isolate, get tested, all that kind of stuff still applies.
Don, are you up or you want me to go?
If you have some questions there, go for it, Steve.
Yeah, I just have, you had mentioned, Dr. Moss, the possibility of the Alameda County Fairgrounds being a large vaccination site. Can you give us some more idea when that may be up and running? Is it definite? Can you give us some more inside information?
As with all things COVID and all things COVID vaccine, nothing is definite. But I think that the hope was to get large-scale county vaccine sites up and running really by mid-February, if not sooner. And so whether that would include the fairgrounds or not, I couldn't tell you for certain today. But that was our planning objective. Now, again, the state threw a bit of a curveball today, and so that could affect things.
And just to follow up with that, let's assume that happens. What will be the protocol for those vaccines to be given out? Is it going to still follow the age tier and essential worker tier, or is it you show up at 6 o'clock in the morning and you get a vaccine, or how's that going to work?
So I think for the time being, the plan has been to make a good, honest effort to reach the people who are in the current prioritized tier. And then, you might not reach everybody. You don't have to wait until you hit every single food and agriculture worker to open the doors to the next group. But you have to make an honest effort to try to make that happen. And so for that reason, they would be limited initially to those priority groups. Again, healthcare providers that have their own allocations of vaccine may be able to move a little bit faster. But I think there's enough people in the 65 and older age group that, to the extent that we were including other people, it would probably be those 65 and older folks. Now, further down, after we get through all those groups, I think the state really wants to just make it age-based. So then they would just say, okay, I'm guessing here, but you're 50 to 65, you can make an appointment at any of these sites. But I think that, again, is still weeks away, possibly a couple months away before we're at that point. So they may start to trickle into some other groups, but I think most of us really need to make sure we're making a good, solid effort to reach those 65 and up and those top prioritized groups first.
Great, thank you.
Okay, so our partner in Dublin continues to have some technical issues, so we'll carry on until she can come back online with us. There is a question here, and I know you already answered it, Dr. Moss, on how long the vaccine is effective. And it should be for a good long time, as I recall. And but But, we didn't really have that long of a time to develop these vaccines. So we anticipate that they will be as effective as any vaccine that we take now that covers us for essentially the rest of our lives. Am I capturing that accurately,
Well,
would you say?
I think so. Most vaccines that we give, they the protection can wane a little bit over time, but for some of them, it takes so long that it's not really meaningful. And for others, we need boosters. And we just don't know which category these vaccines fall into yet. I think also the other thing about this is if the virus does change a little bit over time, that might create another need for a booster in the next couple years. So there are just some question marks there. But I would expect probably years of protection from these first rounds, especially if the virus is relatively stable.
Mm-hmm. And then I have a question here from a particular business sector. It has to do with personal training, and they're just checking their understanding here is personal training is cleared if they do a one-on-one conducted inside, no others, just the trainer and the trainee. Is this clear under the purple tier?
I would have to verify that, but that does sound in the ballpark. Again, the state's website is a good resource, Blueprint for a Safer Economy website. I will also post a cheat sheet that the California Department of Public Health has included. I think that this is most useful for red and purple right now. But you can look ahead and see what they say about orange and yellow as well. But it's a really easy to read table. It's pretty high level. It doesn't go into a lot of detail, so it may not answer every question. And I'm not sure if physical training is in there or not, but it might be considered a personal service. And I'm sorry, I just don't know all of these off the top of my head.
Mm-hmm, mm-hmm. Okay. Any more questions in the chat?
I don't think so, Don.
Steve, how about you?
I guess we have a couple more minutes. We're hearing a lot about additional vaccines that are coming into market. Any thoughts, any comments about those, or what's your? Obviously, that's a good sign. Can you comment about that?
Yeah, so we want more options because we want more supply. So the more vaccines we have, the more factories there are that can crank out vaccine for everybody. And also more options means if for some reason you can't take one of the vaccines, another option might be available for you so you can get protection. So that's great. The next one in the pipeline is the Johnson & Johnson vaccine, which works a little differently from the first two, but and I haven't read the data yet for the Johnson & Johnson vaccine, but my understanding is it has very high efficacy as well, so that's good news. And it's only one shot, and it doesn't require that deep freeze that the Pfizer vaccine requires, and I think it's even a little bit it's just a little bit easier to handle even than the Moderna vaccine. So it's going to be, it's going to have some logistical advantages in terms of distributing it to people who are, where those other vaccines really need to be a little bit tied closer to somebody who can store them properly. And so that's a good thing. It's another thing in our armamentarium. Hasn't been approved yet, but it sounds like the safety data is good, and as I mentioned, it's effective.
Thank you. Don, I think you're muted, Don.
Unmute. Thank you. So on the vaccines, on the deployment of the vaccines, I understand that the demand, we're trying to get the supply to meet the demand. But please keep in mind that there are many opportunities to deploy these in communities, including community centers I am of the generation, I'm dating myself, I can remember as a very young child standing in line at my elementary school for the polio vaccine back in the day. Long lines of people, parents, families, and we did that, and that's how they deployed the vaccine in the islands of Hawaii back in the day. So when the supply starts to pick up, please keep in mind, I know we do need to work with our local partners at the city and the OES in order to engage that. But the community stands ready to help in the deployment of those vaccines. So please keep that in mind going forward. And I think we've got 2 minutes. Steve, got anything else for Dr. Moss? Or
I just see one last question that maybe you want to close it out with Tracy's question, or thank you again, Dr. Moss, for being here.
Sure.
What are the precautions to take if only one member of a household gets the vaccine first and it is months before the others get it?
So right now, vaccine or no, all the same precautions are in place. Face coverings, avoid gatherings, keep things outdoors as much as possible, wash your hands. In the household, we've generally, as long as nobody has COVID and nobody's been exposed to COVID, it's sort of business as usual, even if somebody gets the vaccine. But that person who's got the vaccine needs to be mindful that we don't know yet whether they are safe from passing COVID on to others. So that's that question I was asked earlier about transmission. And because of that, you can't just go to Las Vegas and party and then bring it home to your unvaccinated household members. We might get to that point soon where we have that information and we can relax a little bit. But for the time being, it's really all the same rules apply, even if you get vaccinated. You're not likely to get sick, but you still need to act as if you could potentially get an asymptomatic infection and pass it on to your family members. And then if somebody in the household is sick, I would continue to keep separated in the household, use masks in the household, even for the vaccinated person for the time being until we know more.
Okay. Well, we're right at 3:30, and I just would like to extend to you our deepest thanks again for coming and talking to us for a 5th time. We will circle back with you to continue this in about 6 or so weeks. You were going to put in the chat here the tiers for the receptions. If you could put that in there, that'd be great. It'll be captured on the video that we will then post on our websites. So Dr. Moss, if you would just like to close us out with a final couple of words, and we'll wrap this up.
Yeah, so thank you all for having me. I really, I've appreciated the opportunity to regularly come and meet with this group. I'm really glad to be talking about reopening and vaccine. I mean, these are very hopeful topics. I'm going to, just remind everyone, we are not out of the woods. We could see more surges. We don't know enough about, transmission with vaccinated people yet, and not that many people have got the vaccine. So all the same rules apply. Hang in there. Let's keep doing everything that we know works, and I promise that'll help us get more things open faster. And I just appreciate the sacrifices of residents and businesses across the county and in the Tri-Valley to make this work. I think it's been a tough year, and I think Alameda County residents are really doing a great job. So I'm very grateful.
Okay. Thank you, Dr. Moss. Thank you, Steve. Thank you, Inga. And thank you, Jody. And we'll post these on our websites, and we'll see you all again in about 6 or so weeks. Take care. Stay safe.
Bye, everyone.
Bye.